Hello, Forever Light viewers. We'd like to inform you about the world's new fear, hidden health risk, everything you need to know about human metapneumovirus, HMPV. 1. What is HMPV? Human metapneumovirus, or HMPV, is a respiratory virus that was first identified in 2001. It belongs to the paramyxovirus family, the same family as RSV, respiratory syncytial virus, and measles. This virus primarily affects the upper and lower respiratory tract, leading to symptoms ranging from mild cold-like illness to severe pneumonia. HMPV is particularly concerning for young children under the age of 5, older adults, especially those over 65, individuals with compromised immune systems, people with chronic lung or heart diseases. HMPV infections are often underdiagnosed because their symptoms can resemble other respiratory illnesses. Therefore, increasing awareness is critical. 2. How does HMPV spread? Like many other respiratory viruses, HMPV spreads primarily through respiratory droplets that are released when an infected person coughs, sneezes, or talks. It can also spread by touching contaminated surfaces and then touching the eyes, nose, or mouth. Close personal contact, such as shaking hands or hugging an infected individual. The virus thrives in crowded spaces and during colder months, much like influenza and other seasonal respiratory infections. Preventing transmission is key to controlling its spread. 3. Pandemic parallels and public health. In the wake of the COVID-19 pandemic, awareness about respiratory viruses has increased. Like SARS-CoV-2, HMPV can cause mild to severe respiratory symptoms, outbreaks in healthcare and long-term care facilities, strain on healthcare systems during peak seasons. However, HMPV does not have the same pandemic potential as COVID-19, as it generally causes less severe illness in the broader population. Nevertheless, it remains a significant public health challenge due to its impact on high-risk groups. 4. Symptoms of HMPV in children and adults. In children, runny nose, cough and congestion, fever, wheezing and difficulty breathing, irritability and poor feeding in infants. In adults, cough and nasal congestion, shortness of breath, sore throat, fever and fatigue. In severe cases, it can cause bronchitis or pneumonia. Symptoms typically appear within 3 to 6 days of exposure and can last for several days. In some cases, a lingering cough may persist for weeks. 5. Who is most at risk? Let's dive deeper into the groups that face the highest risks from HMPV infections. Infants and young children. They have underdeveloped immune systems, making them more susceptible to severe illness. Older adults. The natural decline in immune function with age increases vulnerability. People with chronic medical conditions, those with asthma, COPD, or heart disease are at a higher risk of complications. Immunocompromised individuals, cancer patients, organ transplant recipients, and those with autoimmune diseases need to take extra precautions. 6. Prevention strategies. There is currently no vaccine or specific antiviral treatment for HMPV, but preventive measures are similar to those used for other respiratory viruses. Wash your hands regularly with soap and water for at least 20 seconds. Use alcohol-based hand sanitizer when soap and water are not available. Avoid touching your face, especially your eyes, nose, and mouth. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Disinfect frequently touched surfaces like doorknobs, phones, and toys. Avoid close contact with sick individuals and stay home when you are unwell. Additional tips include ventilating indoor spaces and wearing masks in crowded or high-risk environments, especially during respiratory virus seasons. 7. Diagnosis and testing. Diagnosing HMPV can be challenging because its symptoms overlap with other respiratory infections. Tests that healthcare providers may use include PCR, polymerase chain reaction tests. These detect the virus's genetic material. Antigen tests. Less commonly used but helpful in some clinical settings. Early diagnosis can help guide appropriate treatment and prevent further spread. 8. Treatment options. Most HMPV infections are mild and can be managed with supportive care. Rest and hydration are essential. Use over-the-counter medications to reduce fever and relieve symptoms. Seek medical attention if symptoms worsen or if there are signs of respiratory distress, particularly in children, older adults, or immunocompromised individuals. In severe cases, hospitalization may be necessary, where treatment can include oxygen therapy, intravenous fluids, mechanical ventilation if breathing becomes critically impaired. 9. Long-term implications and research. Current research is exploring potential vaccines and antiviral treatments for HMPV. Scientists are also studying the immune response to better understand why some individuals experience more severe symptoms. The long-term goal is to develop effective preventive measures that can protect vulnerable populations and reduce the global burden of respiratory illnesses. Conclusion: HMPV is not a new virus, but its potential to cause severe respiratory illness in vulnerable populations makes it a significant public health concern. Increased awareness, early diagnosis, and preventive measures are our best tools to minimize its impact. Thank you for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health updates and tips. Stay safe, stay informed, and take care.